This is my emergency department. Um, as you can see, in the bottom right hand corner of the ER is where the ambulance would come in, and next to the entrance for the ambulance, there's two major trauma and emergency operating rooms. And then above that in the purple is the imaging rooms with X-ray and CT imaging. Above that in the dark orange is critical care rooms for patients in very critical condition. And then above that in the teal is medication and like general storage. Above that in the green is two staffing areas and a staff bathroom in the very top right. To the left of that is a storage and soiled utility area for soiled utility. And then to the left of that is 5 beds, all monitored by the nurse station in the dark purple in the center of the ER. To the left in the gray top, next to the hospital entrance, is the emergency department observation area, which houses 6 beds and soiled utility and storage areas for patients who need to be under constant observation. And then going down in the dark red is 2 isolation rooms for patients needing to be isolated, which may be because of a condition or they're having a psychotic episode and they need to be by themselves. Underneath that is a fast track room for patients who are projected to be out in the same day and just need to be monitored for a little bit. Next to that in the blue is a bathroom for patients. Underneath that in the yellow is triage, which there is 4 triage rooms in total. 3 on the right next to the line of beds, with 7 on the right and 4 on the left, with a bathroom on the right side of the wall and storage and soiled utilities on both sides of the wall. In the green in the bottom left-hand corner is the waiting area, which then can go up into the waiting area for urgent care, which is attached. And there's 4 urgent care exam rooms. Above that is another storage and soiled utility room, and also 2 imaging rooms. So the 5 ER problems that I chose was non-urgent patients taking up space, which could be solved by the urgent care that I attached. This would be because it would help to refer patients who have less serious conditions or issues to that urgent care to free up spots and space for patients with potentially more serious illnesses or diseases. The next issue is waiting time. This issue could be solved through a more effective triage system in which there's possibly more triage nurses employed, which can take as many triage patients or new patients at a time to work through more effectively. Also with this, more triage rooms. Staffing is an issue, which I believe could be understaffing mostly, which could be solved by just maybe solving this at the root of the issue, which would be college and medical schooling. They could do this by providing incentives or reliefs to those looking to pursue a career in healthcare, just taking time off of the total time spent in healthcare. It would still require a lot of schooling, but not quite as much. And for insurance, I believe that this could be solved through having all insurance companies covering all, not or most of, if not all, of the costs of attending the emergency room, regardless of the emergency. And then technology was an issue because not all emergency rooms have access to the most cutting edge and new technology, which could put some patients at a greater risk to their health because they would have to be transferred to a different location. Um, a resolution to solve this would be to implement more new technology into older emergency rooms through maybe funding to the emergency room so they could acquire this equipment. Um, so my emergency room was looking to have 3 registration clerks, 4 triage nurses, 3 physicians, 6 ER nurses, an anesthesiologist, radiologist, and 2 radiology technicians, 4 surgeon assistants, 3 physician assistants, an urgent care physician, 3 urgent care nurses, and 3 urgent care nurses, which comes out to a total budget for staffing of $3,015,000 a year, which is a lot more than the projected previous year. But this will just be because of the increase in staffing. But this will in turn reduce waiting times for patients. The budget will also need to increase with an additional urgent care added to the ER and staffing for that urgent care as previously stated. So my emergency department innovation was the urgent care added, which will um, which will cut down on the issue of non-urgent patients taking up spots that potentially more urgent patients could come in with, and then needing more urgent and um, direct care there and then rather than the non-urgent patients, which in this case would be referred to this urgent care where they could get the proper treatment instead of having to be admitted to the emergency room, which is truly meant for people with real emergencies. So my patient was a healthy 4-year-old girl who began noticing bouts of dizziness and trouble breathing after playing in her backyard. So she would come into the ER, register with the nurses, wait for a triage nurse to be available, be triaged, and then after the triage, the patient was found to have an inflamed respiratory system and um, a low blood pressure. So the most likely cause would be anaphylactic shock, which could have been from a bug bite or food, most likely a bug bite, since she was a young girl and may not know all of the things she's allergic to yet. And plus, she was playing outside, which there's a lot of bugs outside. So she would leave the triage room and go to a critical care bed where a physician would provide care for her. After the true issue is found and she returns to a more stable condition, whether it was anaphylactic shock or some other unknown condition, she would then be moved to an emergency department observation bed where nurses would constantly monitor and her current state. And then after she's declared normal, she'd be able to leave the emergency room.